Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Hello, my name is Dr. Derek Barron, and welcome to another amazing episode of the Prime Health Podcast. We interview doctors, nurses, and wellness experts and healthcare leaders who are revolutionizing how we approach healthcare and longevity. We explore breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. Now, before we get into today's episode, I just want to do a quick note from our sponsor called Grow Solutions. We are your growth partner for busy health and wealth and healthcare professionals. Now, Grow Solutions, we work to eliminate your biggest headaches. We work on becoming a fractional chief marketing officer, removing some of the roadblocks and stresses, AI and tech overwhelm. We do all of that. So if you've ever told yourself, I'm too busy to grow, I'm too slow to scale, or too overwhelmed to fix it, we can surely help you. Feel free to send me a message via LinkedIn or just drop the word grow below in any of the chats. We'll be in touch with you. But the exciting part of today is our guest that we have. So I want to introduce you to Keri Kaitz. She is a devoted mother of three young, active little athletes residing in New York with her husband, children, and their puppy. Immediately upon graduating from Villanova University, Keri launched her career on Wall Street in private wealth management at Morgan Stanley, serving high net worth clients. During her time on Wall Street, she discovered her true passion for healthcare, analyzing various companies and actively trading healthcare stocks. This passion led to her transition into medical device sales at Tyco Healthcare, then to Genentech, where she spent most of her career in the biotech industry. Having seen the good, the bad, and the ugly in healthcare, firsthand, Keri is passionate about driving positive change. She has always been a wellness advocate, incorporating nutrition into her family's lifestyle. And I love to hear that, especially with little kids. She's currently focused on health optimization at Get Healthy USA, a company dedicated to shifting healthcare toward prevention through disruptive, breakthrough, and cutting-edge technology. Keri prides herself on delivering the same personalized boutique-style customer service she cultivated early in her career on Wall Street. Her unwavering commitment to understanding each customer's or account's unique needs and providing exceptional service remains the foundation of her approach. So, Keri, I want to welcome you to the Prime Health Podcast.
Thanks, Derek. It's great to be here.
Absolutely. Absolutely, my friend. I'm excited for this. So, I want to start this off first by saying, you were in Wall Street, but is there a specific moment in time that really helped shape you to say, what I really do want to work a lot more in healthcare?
It was just studying the stocks and analyzing the stocks. And I learned a lot about the healthcare companies, and I would trade for high net worth individuals. But I was just sitting at my desk and I'm like, this is not really what I want to do. I want to be out there helping people. And I realized that was my passion. So I said, how can I get out there and start that? I didn't have the experience. I had experience working on Wall Street and trading, but to get into that industry was hard. They said it's hard to get into medical devices right away. But what I did was I took a day off of work and I ran around to every hospital in New York City. And I had the chief of cardiology at St. Luke's Roosevelt. I went to Columbia. I had a chief there, and I got them all to sign letters saying that I think you'd be a good candidate to work here. And I faxed them over to the hiring manager. And I'll never forget, it was between me and an Olympic swimmer. He was receiving the faxes through the fax machine, and he goes, you got the job. If you could do that, you can do this. So I started in medical devices, and then I branched out to Genentech, where I spent about 15 years working in the biotech space, in the rheumatoid arthritis space. And it was amazing. And then when I had my third baby, I kind of took some time off. I had a 2-year-old, a 3-year-old, and an 8-month-old. I was number 2 up in the country and I was traveling a lot, and I said, I need to be home right now. So I made the hard decision to leave. And that was the greatest gift. I got to be home with my kids, but I had a burning desire to do more when my baby went to kindergarten. My baby's now 8, just about 3 years ago. I wanted to be out helping people, collaborate, meeting with smart minds. I missed all that. I didn't know what I was going to do because they're still young and they still need me. Right now they're 8, 10, and 11. I don't want to go back into the corporate world and spend all those hours and trade time for money. And I still want to be around. So when this opportunity presented itself, it was an answer to my prayers. I discovered the Biophotonic Scanner, which we can get into, but it's been amazing.
Yeah. So what was some of the early med tech that you worked in? Can you share that, or is that privy to that you have to be careful what you share, but some of the technology that you worked with before?
Yeah. So the first thing I did when I was in medical device sales, it was a long-term and short-term hemodialysis catheter. And I sold to vascular surgeons and interventional radiologists. And I was right there in the OR and I helped them do the procedures. And then when I went into biotech, it was the drug that we promoted was Actemra, and it was for rheumatoid arthritis. And it was amazing. And I loved the rheumatology space because it was always evolving. And there was so much that they didn't know. The doctors didn't know. I had doctors tell me, we can never retire because it's so interesting. There's still so much we don't know. And I loved that.
Right.
And I loved selling that because I always say, if I sold something, I'd have to truly believe in it. You know, I could never be a used car salesman. I believed in it. God forbid someone in my family got that disease, I would recommend Actemra. And it was really amazing. We're truly helping patients. And I love that. And I know there's HIPAA and all that, but when a patient comes out into the waiting room and hugs you, I mean, there's nothing like that.
No. I love that part of being the clinician. That's a wonderful thing. So you mentioned it before, you're in this new space. You're utilizing something called the Biophotonic Scanner. I've got a few questions, but first, can you tell me, what does it measure?
Yes. So it measures antioxidant levels in your body in real time, non-invasively.
Okay.
It's as accurate as a biopsy and more accurate than a blood test. Specifically, it measures carotenoids. It's a carotenoid antioxidant, but we say antioxidants because the level of carotenoids correlates with your overall antioxidant network.
All right. So it measures that. How does it measure it?
Great question. So it uses something called resonant Raman spectroscopy. It's based on scattered light. So it will emit a blue wavelength precisely, 38 nanometers. When that resonates with a carotenoid, it will produce a light that's 518 nanometers, a green light. And then it's counted. And then it'll produce a score right then and there. So in 30 seconds, you'll get your score right then and there. And then it's attributed to different colors. So it's red, orange, yellow, green, blue, purple, red being the worst and purple being the best. Red's in like the 10,000 range, purple's in the $80,000 to $90,000 range. And then we'll give a grade to your score. Like a red would be an F. A yellow would be, an orange would be a D, a yellow would be a C, a blue would be an A, and a purple would be an A++++.
Okay. So how many people that do the scan show up as an A+++, meaning are purple?
So 94% of Americans will get score red, which is really sad. They'll get an F. And most kids too, because most kids, their fruits and vegetable intake is, potatoes is their vegetable and ketchup is their fruit.
There is some truth to that.
Yeah. 94% of Americans will fail, but we have the solution to help them, which is great.
Okay. Now, you told me how it works. So how does somebody truly get a scan done with the Biophotonic Scanner?
Yeah, we'll actually have it right here. You just put their palm of their hand and put it over just like this, nice, small, and portable, and they'll get their reading right there.
Okay.
No pain, non-invasive.
No pain. It's non-invasive.
People have asked, not dangerous, not painful.
Yeah. And it takes 30 seconds for the scan.
30 seconds. You'll get your score.
Okay. And I'm sure we'll get into this, but I would assume you have something that helps them to increase their score over time.
It is true. We have products called scanner certified products. We have certain ones that are scanner certified, and they're guaranteed to raise your score. You'll get a baseline score and come back in 60 days for a rescan, whether you're a patient or a customer. Your score is guaranteed to go up with these products. If not, we have a performance guarantee. We're actually the only company that has a performance guarantee that will give you all your money back if your score does not go up.
For 60 days, I take all the supplements. My score didn't go up. You'll give me my money back.
Yeah, as long as you're compliant. We can't control if you're compliant if you take the vitamins.
Oh, that's fantastic. Okay. So, when we look at devices, or we look at ways in which, like, somebody that's a type 1 or a type 2 diabetic and they're wearing a monitor, a CGM, something like that. So are there clinical studies that are speaking about the benefits of the Biophotonic Scanner?
Great question. So we actually have 110 peer-reviewed published studies on the scanner alone. Never mind our products, we have 2, but just on the scanner alone, we actually have a Yale study. It's a 10-year Yale study. And what it shows is 2 things. One, it's the best way to measure fruit and veggie intake in the human body. And two, it's the best way to affect behavioral change. And that's a big deal because when someone gets this score, it's meaningful to them.
And behavioral change, meaning, okay, I got an F. What can I do? I would assume taking the supplements, the vitamins that are there is fantastic, but I'm sure, being in the healthcare industry, you're also educating them other steps they can do to improve their health.
Right. So other things come into place. You still have to
Great point. Note to self.
Sleep, smoking, exercise, all those things, stress, those all come into play as well. You still have to eat healthy. So the National Cancer Institute is pounding the table saying the recommendation for fruits and vegetables is anywhere from 12 to 15 servings of a variety of fruits and vegetables. Yeah. So that's the average American will get.
1.3.
So can you get everything you need through your supplements? Through your diet? Maybe, but it's not practical, especially with today's where crops are grown. So it's not sustainable. It's not affordable. And some Americans flat out just don't like it. We're just hoping to close the gap, close the spread. If we can get you on a supplement and you can eat healthy and get you up to those servings of fruits and vegetables.
Love it. So I assume in healthcare, we know this is a true question, but I want to see how you answer it. There's big misconceptions of people that are taking supplements, but taking your supplements along with the scanner, can you kind of dispel those misconceptions? Like what makes it smart for somebody to take a scan and then take the supplements? What's the benefit in it for them?
Yeah, so we can prove that that's the other thing. So not only do we measure antioxidant levels, it answers the $1 million question, are your supplements working? Because how do you know? You could be dumping money, $300-$400 a month on supplements, and you have no idea. The supplement industry is a train wreck. Let's be honest. It's a complete train wreck. It's scary. Right. People are going up and down the aisles at GNC and Walmart, and they're relying on teenagers to recommend products to them. They have no idea if they're working. They're picking the most expensive one because they think, wow, this has to work. So I don't know if this works. And, fancy labels, influencers, they have no idea. There's very, very, very vague government regulations. And so it's hard. So this will tell you. So if you're taking a supplement and we scan you, it'll show you if the supplement you're taking is being absorbed in your body. And most of them aren't. Most of them are garbage. So
So basically, somebody could be taking supplements right now. They get scanned and they're at an F, maybe a D if they're taking supplements. They start taking yours, they're going to slowly 60, 90, 120 days start to climb up to the next level, hopefully to the purple.
Yes, because you really have to look behind the curtains. We have, we're a nutraceutical company. We have 75 full-time scientists on staff. Just to give you an idea, most have maybe one. Half of ours have PhDs. We have strict testing. Every single supplement before it gets to your house is double-blind, placebo, crossover, randomized, studied, with the purest, cleanest supplements on the market. So much to the point where we were the first supplier to the Olympic team of supplements. Not only sponsor, but supplier. And we've actually sponsored them 3 times. And I don't know another nutraceutical company that can say that. So we like to say we're a nutraceutical company with pharmaceutical grade supplements.
Okay. All right. So types of providers that can utilize this in their practice. Can you give us some that would benefit from having the Biophotonic Scanner in their practice?
Yeah. The sky's the limit. So definitely chiropractors, functional medicine, regenerative medicine, primary care, OBGYN. We have orthopedic surgeons coming on board now. They're coming on board because they're looking for extra streams of revenue, but they're also realizing that surgical outcomes are optimized, healing, when they go on our supplements. They're developing protocols. We have one that won't even operate unless they go on one of our supplements before and after. And he's got a strict protocol.
Very smart.
Honestly, it's pretty much every single specialty. Because if you go into PubMed and put in any affliction, any disease, and oxidative stress or antioxidants, you're going to see a correlation between low antioxidants and high levels of disease. So we have podiatrists.
Wow, that's great. Now, what attracted you to, you kind of told us already, but what attracted you to the Biophotonic Scanner as a business?
Yeah, that's a great question. I'll never forget. I was walking my dog and then I heard someone had sent me a webinar about the scanner and I stopped in my footsteps. I'll never forget. I just stopped and I was like, it just made so much sense to me. One, there's a $60 billion nutraceutical market out there. That's how many, how big the market is in the US. And I think it's like 340 billion in the world. So there's already an established market. And then this device that, can help doctors create an additional revenue stream, and empathy towards the patients. They can optimize their health and they can empower the patients to optimize their health. It seemed like a win-win for everybody. Like, this just makes perfect sense.
Yeah, love it. Are you looking for providers to come on board and, try the Biophotonic Scanner?
Yes. We're looking for more. We have a couple. Well, I have a couple personally. We have a lot on our team. Yeah, we're looking for more providers to join the business because, there's a couple different ways you can make revenue. You can make a cash revenue system, and you can make revenue through testing. And then you can make revenue every time you prescribe or recommend a product, and that product is direct shipped to your patient. You'll make revenue on that product. You don't have to, stock supplements in your office unless you want to. You don't have to do that. You don't have to worry about that. Because a lot of doctors will say, "Oh, I don't want to, keep supplements in my office. There's shrinkage, there's inventory, there's all." You don't have to do any of that. We take care of everything.
Okay.
We direct ship to the patient. So it's really providing cash revenue to the providers who are struggling and are looking for side gigs. So we all know healthcare is broken. We can talk about that later. A lot of them, due to healthcare being broken and not having time to spend with their patients or practice the way they want to or are trained to practice, they can have that nutritional conversation in a minute. Because a lot of them will say, "I want to incorporate nutrition. I just don't have time. I don't have time to talk about nutrition. Where do I start?" So now it is so easy. You give them a score. You say, "This is where you're at. This is where we want you. And this is what you do about it." That's it. And they're able to do that in their office very easily.
What are you personally focusing on right now in your business?
Right now, I'm focusing on getting more providers on board because we really have seen success with them. And they can reach a lot more patients, right? So that's why we're focusing on that. I'm also focusing on building my team. Reason being, with more, people like me, more consultants like me, we're coming out with a new version of the scanner. It's what we call the Prism. And it's going to be big. It's going to be a massive deal. Right now, we only have about 3,000 scanners in the whole country of this current S3 scanner. The Prism, we're going to probably the first quarter of next year launch about 10 to 25,000. They think 1 million scanners in the first year.
Wow.
10 million by 2000.
That new version, the next version of it will be smaller, almost like I could have it in my home.
It will be the size of a hockey puck. And it will have this antioxidant measurement, which is an important biomarker. If it only had that would be gold. But it's going to have 25 to 30 additional biomarkers powered by AI and genetic testing. We bought an AI company and a genetic testing company. So that's all going to be kind of incorporated into it. I don't know much about what those biomarkers are going to be. Maybe collagen, maybe something with skincare, maybe protein. I'm not really sure, but it's going to be amazing.
Okay. Love it. Love to hear. So from your business perspective, again, Get Healthy USA, what's the biggest challenge that you're currently dealing with in your practice, in your business?
I think it's just trying to capture market share as fast as we can. I feel like we're in a race. It's kind of like a gold rush to capture as much market share as possible. So when these scanners come out, we can implement them fast. Our team, we control 90% of the market. But once the whole company catches on and this goes massive and this goes out to the masses, we're going to be competing with a lot of other people. So I think it's just to capture market share. I feel a lot of pressure to get out there and get as many of these scanners out here as possible, because whoever has this current scanner will be grandfathered into getting the new scanner and will be on the list to get the new scanner first. I want our team to have as many as the new scanners first before they go out to the masses.
Okay. So let's step back a little bit, maybe from a clinical standpoint. I'm a patient that goes into a chiro that's on your team, or maybe somebody in your neighborhood, they see you. Can you kind of discuss realistic expectations and timelines? I know you were saying in 60 days you get a rescan. I can't imagine many jump from red to purple, but like, what is it to go from one level to the next to the next?
Yeah, and again, it depends on everybody, your lifestyle, your diet. I think it would maybe it would go up at least 10,000 points.
Is each point 1,000, 10,000?
Yeah, so this would be red, this would be orange, yellow, green, blue, purple. This is the best, this is the worst. So it jumps up in range. So 10 to 20,000. So I would say it would jump up maybe, and we don't care about the numbers, we care about the colors, the range. So I would say if you're at 10,000, maybe to jump even just up one and slowly up another one. But some people will go up like 40,000 in a month. It's crazy. You just never know. And then it depends on sleep, stress, diet, lifestyle. But you'll definitely see an improvement. Some people feel improvement. Some people don't. Say after 4 days of taking the vitamins, I have so much energy. I mean, maybe a placebo effect, But it's like high blood pressure medication or a statin. You don't feel that. So some people won't feel anything.
Yeah. Even if somebody's wearing like a CGM on their arm, they're just testing themselves for, hemoglobin A1C, their blood sugar levels. Depending on their swings, they may not feel better, but they're in better control. This allows you to show people, here was my starting point. Here's where I'm at month after month after month, and always progressing.
Yes, exactly. I mean, we had a marathon runner. She failed the test. She tested like a smoker. No. So you could be really fit on the outside, and on the inside, your cells are not nourished. So it's like she was running out of gas. It means your cells are running out of gas slowly. Like something, they need to be refueled.
Okay. Wow. I love that. So you have success stories of pre-scan and post-scan?
Yeah, actually, someone just came on our team. He was a medical rep. He said he went to his primary care. He started on one of our foundational vitamins, LifePak Nano, and one of our epigenetic products, Age Lock Youth. And he said his doctor appointment, the doctor's like, what are you doing? Your A1C has never been better. What are you doing? And then he said he went to the eye doctor and his eyesight has improved. It's improving. Okay. And he can only attribute it to the supplements. Another one, she actually joined our team. She's a practitioner. She started one of our epigenetic products. It's called Age Lock Meta, and it's supposed to help with metabolic health. So it's not scanner certified. It doesn't necessarily mean your score is going to go up, but she is now off her high blood pressure medications. Her blood pressure has gone down. We have another woman who is she has rheumatoid arthritis, lupus. We can't make medical claims. I'm just sharing stories. She was on Remicade, prednisone, ton of other heavy drugs. And she's off all of those now with our foundational vitamin, one of our probiotics, I think, and then one of our epigenetic products. And that's major.
With your supplements, are there age ranges in which people should or shouldn't consume them?
No, except for children. We have children's ones. Yeah, they're called Genlimals, and they're chewable and a drinkable version for them. And actually, you're gonna laugh. Some adults, they don't like they'll say, "Oh, I don't like swallowing." That's actually a challenge I have. They don't like swallowing pills. I'm like, all right, well, first of all, don't put your head back. You put your head forward when you swallow.
I saw that on a TikTok video, and I couldn't understand it. I was throw my head back, let gravity and let speed take place. All I did was lean forward and went down, and I was looking for it in my mouth. It was amazing.
So they can crush it up, put it in their applesauce, put it in their yogurt, or we have drinkable ones. We have something called Superfruit and Siberian Pineapple. That's scanner certified. That'll raise your score. So we have something, we have something for kids, something for people who don't like swallowing pills. And then, the other ones, I think it's 18 to 100 are foundational vitamins.
Okay. So how do you see Get Healthy USA kind of helping with our current healthcare crisis that we have? How do you feel that you're intervening?
Yes. So I feel people looking for answers. Especially since COVID, they're looking for more natural ways to protect themselves and do a little bit more for themselves. They're realizing that allopathic medicine doesn't have all the answers. Providers too. Listen, there's a place for it. I respect allopathic medicine. We need it, of course. But this is kind of empowering people to take control of their health and get to the root cause of disease. And this is empowering individuals to get a score and help themselves, and putting the power back in the physician's hands instead of the teenager at GNC. Because when I go to a doctor, I want them to tell me what to do. What do I take? What do I do? And it's just putting the power back in their hands to make the recommendation, to show them how to improve their health.
Yeah. It's not that the kid behind the counter, he or she has any ill intentions. They're doing what they want for their job, and they're helping. And at times they do help, but there's definitely a different quality, I'm sure, with your products and supplements than there is at a GNC store. I used to work at a GNC part-time. So no, that's okay. They have some great products, and it's just a supplement store. It's to each their own. If you don't eat an apple and you start eating an apple today, it's going to give you a benefit. It just depends on how good the apple was and the dirt that was underneath it.
Right.
Yeah. I know you weren't picking on GNC, and neither am I.
Or Walmart. Actually, I think that Target and Walmart, and it wasn't GNC, had a cease and desist order. Maybe in 2002, I forget which year, about their supplements. They found sawdust and all kinds of stuff in them. Because you just don't know. And that's the other thing. Our supplements not only test for what's in them, we test for what's not in it. We test for 600 contaminants, pesticides, herbicides, carcinogens, heavy metals, because our supplement is LifePak. So we want you back for life. So can you imagine if you're micropoisoning yourself little by little? These supplements, you don't know what's in them. So you have to be you have to be really careful and look behind the curtains. look at the research, look at the advisory board, their scientific process, how things are sourced, everything like that.
Let's talk about your business again. What do you see is on the horizon for Get Healthy USA and the Biophotonic Scanner that excites you about healthcare moving forward?
Well, I'm really excited again about Prism. That is going to be the new version of the scanner. And I think it's going to be more scalable. I think it's going to be a smaller barrier of entry for physicians and patients. I think more physicians are going to be able to get this in their hands and really help patients. Not only they'll be able to have it in their office, but they're going to be able to, I think, sell it to their patients as well. So the idea being the patient can bring it home and scan themselves and scan their whole family. And then it'll be connected to a physician's office somehow through a CRM. We have a whole marketing drip campaign, and the physician will be able to see their scores, and there'll be recommendations that are made to the consumer or the patient right then and there. They can purchase right through the app, and it's going to be amazing. I think we're just going to be able to help so many more people than we are now. We're already helping a lot of people, but just having more of these devices out there, we're going to be able to help so many people. Because I truly believe, every disease, if you look at the antioxidant levels and the oxidative stress, it's a contributing factor, root cause. You never want to have oxidative stress or chronic inflammation in your body. And that's what this device is showing.
I love it. Everything is heading to AI, fortunately and unfortunately. Yeah. But in this case, it's a device that can actually give us ideas and markers on how we can improve our health along the way. Now, I'll share all of your social media links and everything that people can learn about you. But if someone wants to get in touch with you, whether they're a private individual that wants to learn more, or if they're a provider that would like to consider putting this into their practice, how can they get a hold of you to maybe set up an appointment?
Yeah, you can contact me directly. My number is 914.
I wouldn't give that out just in case, because it's going to go on the World Wide Web. We'll put some stuff inside there, but like from a website, do they have a website that they can see links in there?
I have a website. It's kerikaitz.gethealthyusa.com.
Okay. So the last question that I want to ask of you as we wrap this up, Keri, is what does Prime Health mean to you?
Well, I'm very excited to be on this show, and I thank you again for inviting me. I think it's amazing. It's an amazing platform to help each other and connect with other providers and medical professionals and even patients. I think that's an amazing platform, and I commend you for having this.
Well, thank you. I appreciate it. If you think about those two words, what is Prime Health and the Biophotonic Scanner and utilizing your scanner certified supplements? How does Prime Health focus on the people that are taking those products?
Well, I think that Prime Health focuses a lot on functional medicine and regenerative medicine.
No, it's okay. So like what I mean by Prime Health is what you're doing is you there's priming the pump. It's making it better. Prime is good. In other words, we were talking about going to a supplement store. They can get a supplement from you and your company. They can get scanned. If people want to achieve Prime Health, I would think they would want to, first of all, get scanned, see where they scan. Second of all, if they're interested in the business, they can learn about that. Third of all, if they want to bring that into their practice, they can do that too. All of it is improving their Prime Health. I just think it's a great way in which it can be done.
Yeah.
Cool. All right, Keri. Well, I want to say thank you very much for attending the show with me here. I learned from every guest I have. I really learned what you had to share. I'm excited to hear about the Prism and where that is going to take you and your business. What's very unique about this is how you kind of came into the business. You're extremely intelligent from working the money side of healthcare. Now you're working the passion side of the healthcare, which will bring the money side of healthcare to you as well. For the viewers and listeners, if you found this podcast useful and what Keri had to say, and if you're interested in the Biophotonic Scanner, share it. When you're out having coffee with someone and they're like, I just haven't been feeling well, maybe you need to consider trying them from another location or another place. And I think Keri is a great place to do that. So it's really about sharing for friends and family and colleagues that that can benefit from it. So of course, selfishly subscribe to the Prime Health Podcast. We'd love to hear what you think about it. If you have any questions or concerns, drop them in there. Myself or Keri will answer those for you. So until next time, remember that true wellness is a journey that we are all on together. Whether you're taking charge of your own health or guiding others in theirs, every step forward matters. I want you to all take care of yourself. Keri, again, thank you very much for being a guest on this, and I will see you next time on the Prime Health Podcast.
Thank you, Derek.